you don't know who I am, my name is Liz and I'm a second-year dental hygiene student in the state of Colorado. I have been asked multiple times to film a what's in my bag video, so I figured I would film it now without really planning anything because I'm just going to show you what actually is in my bag, and if you guys have any questions, I'll answer them. So this big boy is my backpack. This is what I take to school on lecture days. So let's dive right into this bag. We have some goodies. So everything is probably from Amazon. If you guys need links to anything, please comment and let me know and I will try to find the link. But this right here is just a cute little pink bag, and inside I have a bunch of chargers. So I've got an iWalk portable charger for my laptop and my iPad. I have a little charging block and a cable for another USB-C. And then I have another charging block and a cable for the old iPhones, just in case I need to use it for anything. So I have all those chargers because my lecture days are long and you just never want to go into a lecture day with the possibility of some of your stuff dying, or what if I forget to charge it? I'm so tired and I forgot to plug it in, or you never know what could happen, but I like having extra chargers just in case. And then in this one I have another iWalk, but it's specifically for my Apple Watch. I have never used it actually, but I bought it and it's in here just in case. In that same pocket of my backpack, I have a few other goodies. Here's just a little clear baggie. I have a deodorant in there, a tiny little concealer. This is a Nest oil that is in the scent Madagascar Vanilla. I have a hair clip, a hair tie, a hair clip, chapstick, Aquaphor, and a makeup wipe. I cry a lot at school. If you guys have seen my other videos, you know that I'm more often than not crying, and so for that reason I have the concealer and the makeup wipe just to better prepare myself for anything that life has to throw at me that day. All right, moving on to the big pocket. On the side over here I have this little baggie, and inside lies a pair of blue light glasses. This is what they look like. They're super cute, and I carry them in here because I struggle with migraines. I am on a prescription migraine medication, so blue light glasses are a must, especially on long clinic days. For example, my next semester that starts next month, I'll be having lectures on Thursday from 8 a.m. until 5 p.m. on the computer in lecture the entire day. I cannot be on my laptop that long all day without these blue light glasses, so that is in here. I have a packet of tissues, Bath & Body Works Aromatherapy Essential Oil Mist in Stress Relief, which is eucalyptus and spearmint. I love this stuff. I usually actually spray it and then step into it on exam days, so love that. I have a little baggie of screen cleansing towelettes. This is for the iPad, my laptop, my phone, whatever needs to happen. There's just a few in here. I have a little pack of sticky notes, very important. I've got a hand sanitizer spray in, what is the scent? Aloe You scented, which is, it's very like aloe / cucumber scented, but yeah, I have that in here. I have a travel lotion in my bag because I'm washing my hands often throughout the day. I have a cocoa floss in my bag. This is in the scent orange. If you guys haven't used cocoa floss, I highly recommend it. It's rope textured, wax free, and it's thicker than normal floss, which makes me feel good because I feel like it's actually working. When I do C-shaped flossing on my teeth, I feel like it's actually scraping up the buildup, so highly recommend cocoa floss. Again, this one is in Cara Orange, but it's blue. And then I have little cheat cards. These are hygiene cards. There's the different types of gingival recession, gingival descriptions, oral cancer screening, there's what to palpate or examine, facial lymphatic system, different vital signs, ASA classifications, oral pathology conditions, mobility and furcation classes, as well as the GB Black classifications, permanent dentition and their eruption sequence, that's huge, that's a good one, as well as primary dentition and their eruption sequence, local anesthesia. Wow, that's pretty neat. I haven't really looked at this, I think you can tell, but I have another pocket back here, and in here you will find Excedrin, migraine relief, some stress relief lozenges. This is in the flavor orange and elderflower. Highly recommend spray gum for xylitol. Xylitol is extremely good for you when it comes to cavity prevention as well as dry mouth and stuff. A few lady products. I have some Tylenol. So that's all I have in that bag. Let me put it all back. All right, moving on. This is my pencil pouch. I'm obsessed with this pencil pouch, special brand. Anyways, so when you open it to the first little pocket, I actually have it set up according to my planner because I color code all of my classes. So these are all of the colors that I'll be using for my fall semester in order of which class comes first on lecture days, and the little black pen that I use to write down the assignments. So the way that I make this, actually I'll show you guys in more depth if you want like a little planner tutorial, but I use the colored marker to write the class name, the black pen to write the assignment, but then the color highlighter that correlates to that marker when I complete it. So that's kind of how I do that. So this is what it looks like. In the big pocket, I've got a bunch of goodies. Let's dump it and look through. So I got another little stack of sticky notes. I'm currently using this color for nutrition, but in the fall I'll be using this color for clinic. So these colors are still in there. This is a tape whiteout tool. Love that. I have a skinny Sharpie and a bigger Sharpie. Sharpies, I've noticed in hygiene school, are like necessities. It's kind of wild. I have 2 mechanical pencils right here, and then I have a few black pens. I like the way that they write, and I have quite a few just because I do use a lot of them, and it's better to have extras. Why not, right? In this last little pocket, this is what it looks like. I have a bunch of paper clips and binder clips. I have another little whiteout tape tool. These are super cool, you guys. You can find them on Amazon. It's a little roll of see-through tape that you can like peel and rip and put into textbooks. So if you want to highlight something in a textbook but it's not yours to write in, I highly recommend these. I have pink and yellow, and I do use them often, not as often as I would like. Like, I've never replaced these, and this has been used for the last year, and I'll probably use it for the next year. So I definitely don't use much, but that's because I tend to buy or download my textbooks. But anyways, highly recommend these little book highlighter tape things. Right here, I have these magnetic binder clips. They're really cool. You just open it like that, pick your page in the book, and magnetize it closed so that you could just flip to that page. So I have a few of those right here, as well as an eraser and extra mechanical pencil erasers, extra mechanical pencil lead in both of the sizes that my 2 pencils are in this pouch. So that is my pencil pouch, you guys. I'm a huge fan of school supplies, so you might see a lot of fun things in my backpacks because I just like love collecting stuff. In the side pocket, I obviously have my iPad and my laptop. This comes with me every day to school. I just recently upgraded my iPad to the 13-inch, and then this is my laptop, a MacBook. And then I've got my planner. This is my planner for the next year. And I have this little cute bookmark to take me to the correct page, and everything in here is organized by the correct colors and there's a few cute stickers and stuff. So yeah, that's my planner. And then I've got this binder. I'm gonna be honest, I don't use it as much as I thought I was gonna use it, but it's fine. This is my summer semester schedule. I'm about to change this today to my fall semester actually. I'm really excited to do that. But when you open this binder, I have these, they're little see-through binder folders that have Velcro for you to input some paperwork, and I always label them for the class, and then any like documents that we do get or any assignments that I turn in that were printed and graded or anything that does come in paper form just goes back into the class folder. So I need to switch these out for my fall semester as well, and to be completely honest with you, I haven't used them much. I think in histology and embryology I used them to put my tooth drawing graded assignments in there. I think I printed all of my syllabuses for that first semester, so they were all in each folder, but I haven't used them really aside from that. So yeah, but better to be prepared and have that there. A few sheets of lined paper just in case I'll ever need it. To be honest, I should pick a notebook and put a notebook in here just in case as well. Maybe I'll do that today. I have a few extra. And then for Christmas, my secret Santa was my brother-in-law, and he had everyone write me little letters, and so I laminated them and put them in my binder because they made me so happy. I'll read you guys Austin's. It says, "Merry Christmas, wifey," which is so cute because we weren't married yet, but that's adorable. He said, "Congratulations on making it 25% of the way through school. You're seriously crushing it like faux real. I am unbelievably proud of you and what you've accomplished so far. You got this and I got your back. I love you, Austin." Isn't that just like the sweetest thing ever? And then my sister-in-law, my brother-in-law, my mother-in-law, and my brother-in-law's girlfriend all wrote me a little letter, so I have that here just for motivation. But yeah, that's everything that I carry in my backpack. I'm gonna grab a notebook real quick so that I don't forget. Also, I do carry some stickers in my backpack that go with my planner. So it's a bunch of planner stickers like due today, to do, checklist, this week, little, I don't know, they're just like really cute binder stickers. I am a sticker fanatic, so I love these and they always stay in my backpack for easy use. This is the notebook I chose for my backpack. I probably will never use this. My intention is not to use this. I take all of my notes on my iPad, but it's good to just have some paper laying around in case you need it. This is the one I chose. When I'm done giving you guys my bag tour, I would really like to go try to find my books for the next semester, so when I do that, I'll show you those as well. But now let's move on to my next bag, which is one of my clinic bags. It's gonna be the purse one, and I'll show you everything that I keep in there. Okay, so this is the bag that I use for clinic. This is my purse bag. My student badge is on here, as well as a little pocket for my flash drive that has all of like the clinic notes and stuff that I need to upload with each appointment. I have a little clip on my bag right here. It's a big safety clip with a toothbrush, toothpaste, floss, and a tooth. In my side pocket right here, I've got masks. So these are all of the masks that my school provided for me specifically. It has my HY number on it. That's just our student numbers. So those are my masks. And on the other side, I have a little to-go spray. It's in the scent Clementine. You're in clinic in all of your gear, super sweaty for hours and hours and hours and hours on clinic days. So it's nice to just have the option to like spritz myself during lunch or something. And then in that same pocket, I've got a hair tie and a hair tie. Whenever I do my hair for clinic, I slick it back into a low braid and then I bun it up, and usually use this to like tie it up, and then that's what my scrub cap like ties on. So I carry that in this outside pocket just so that it's easy to use, quick to grab, and accessible. When we dive in, I have my huge clinic manual. In here, I have absolutely everything that I may need for clinic. I've written them all myself. So that's like what it looks like. For example, this is a clinic checklist. It tells me what to do prior to my appointment, and then it tells me what to do once I have my patient in my chair. So you start with x-rays, you receive their payment, you do the radiographic interpretation.
Card charting, the IO, oral cancer screening, a doctor's exam, gingival description, occlusion, overbite, overjet, midline deviation, open bite, labial version, and then the class occlusions, perio assessment, so probe depth, bleeding upon probing recession, furcation, fremitus, and mobility. And then down here I do have like
Fremitus is done only on maxillary teeth, and it gives you like what you would write in the clinical note, and then ADLs, mobilities, furcations, malpositions. Long story short, it tells you like step by step what to do, and then there's just a bunch of graphs to help me out. Here is my plaque index score. Sorry, my GoPro died. So for the plaque index score, which looks like this, I use a dry erase marker to fill it out per patient. And then I have my periodontal classification worksheet. On the back is all of my graduation requirements. So this is kind of what it looks like. It says progress, where are we at, and it has boxes for how many of everything I need, and I'm kind of checking it off as I go. We use Dentrix at my school. If you guys use something else, let me know, but I actually did use Dentrix in my work office as well before I came to school. So I just have a few written down step-by-steps of how to use Dentrix. So like restorative charting, I literally wrote down where you would find what and what to click. And then for Sodexis, like taking images, importing, exporting, perio charting, stuff like that. I have the ALARA principles, the as low as reasonably achievable principle for radiographs. I have Carrie's risk assessment form for ages below 6 and ages above 6. I have a PRA form, periodontal risk assessment form, and the job, we have clinic duties. So I wrote down all of the duties for the CA, RADA, and screener. And then I have clinical notes, little cheat sheets for myself. I created gingival description, color, size, shape, contour, consistency, texture, and then I have sleep apnea classes. I have IO, EO, everything that I would be looking at, and then I have a bunch of pathology that I took photos of and placed into my personal little binder. It just helps me keep an eye on some things. And then I printed out the ASA classifications as well as blood pressure protocol. And I have a little mouth. I printed this out to use for OHI if I ever need to, and I've only used it like twice, and it was with pediatrics. And then I have all of my PEs, my what are they standing for? Procedure evaluation, like test outs. I have all of those listed here, so it's nothing you guys need to know about because it's going to be dependent on your school. And then that's pretty much it. So that's my clinic manual binder. I've definitely complained about making these, so if you've been watching my videos, you've heard it before, but this is my drug card book. I've created all of these drug cards from scratch by myself using my drug book, which is right here. This is my drug book. Okay, it is Drug Information Handbook for Dentistry, and all of these drug cards are from this material. Okay, so how this works at my school and probably at a few other schools as well is you need to have a drug card for absolutely any medication that could come be your patient. So I ask my patients what medications they're on, and I create drug cards, and then I use little colorful stickies to keep track of which patient of the day is which cards, and each drug card has to state the brand name, the generic name, the classification or action, the indications or uses, side effects or adverse reactions, and then dental considerations for every single drug that people could be on, literally from birth control to vitamins and minerals to medications that are over the counter or prescribed. I literally have cards in here for fenugreek, but I also have cards in here for, like, this one is Vistarel, which is hydroxyzine. It's an antihistamine. So like stuff like that. So I have a billion drugs in here for that reason. My anesthetic notebook, I love the way that this turned out. This was an assignment for my summer semester, so it's very new. But here's my notebook, and inside you will find ASA classifications, blood pressure protocol, maxillary injections. So literally it has the name of the injection, the penetration site, the needle pathway, deposition site, needle selection, depth of insertion, amount deposited, what it anesthetizes, and then a few photos. Every single injection has that. So I have maxillary injections, palatal injections, mandibular injections, and then I have anesthetic info. So here are drug cards for the anesthetics. And then I have pediatric dosage calculations for adult MRDs, visual cues. I don't know. It's just a bunch of stuff that are going to be nice to look at in the moment. I have my tiny little planner. This is my clinic planner. I have told you guys before to get a planner specific to clinic with no school info in it at all. So that is what this is. I keep track of the clinic days that I need filled. Let me show you guys one that like doesn't have names on it. So for example, this is the week of November 1st. I have clinic that week only on Wednesday, and I actually am on CA duty in the morning, and I just need a patient in the afternoon. So this is where I would write the patient's name. And that is how I keep track of my clinic schedule for the semester. Little planner is literally my lifeline when it comes to scheduling patients. I have so many scrub caps. This cute blue one. This cute black one. Oh my gosh, just a nice black one. Aww, I have this one where all the teeth are in pain. It's so sad. Pink one. This one's so fun. I wear this one a lot, which is why it looks so ratty. This is one that has like a bunch of tooth jokes on it. And this is one I like to wear in the winter a lot. It's a bunch of teeth that are cold. It's a bunch of teeth, like all of them are. It's like a bunch of medical stuff. Last but not least, I have just like this floral one. And then we have my pencil pouch. This is the best pencil pouch in the world. Probably not literally, but it's just so funny. I love this one. And I have a bunch of stuff in here, you guys. So let's see, shall we? I have a skinny Sharpie, a ginormous Sharpie. I've got multicolored pen. This is a must in clinic. I'm not kidding, because you need to write specific things in specific colors. So go get some of these. I have another ginormous Sharpie. I have a Vaseline. I have another cocoa floss. Ooh, sorry. I have another changing pen. For every single patient I see, I always have one in my lab coat and one with a barrier on my counter. So I always have two out. I have a tiny little lotion. I have little sticky notes. I have an Expo pen. I have another Expo pen, and I have a third Expo pen. That's for, you know, the plaque index and a bunch of other charting stuff. I've got sticky notes. These sticky notes, I literally place like 3 on my counter where my computer is every appointment, just in case. Like, I have a pen in my hand when the doctor comes in for a doctor's exam, and I have these empty sticky notes to write down anything that I need to write down. So that's what that's for. I have a bunch of cough drops. You never know. I have a hand sanitizer. I have another multicolored pen. I have a highlighter, another highlighter, a mechanical pencil, a hair tie, and super important, you guys, I learned this way too late. I have a travel nail file. You're not allowed to wear even a clear coat in dental hygiene school, and when your nails are as flimsy as mine, or when you're as stressed as I am and you're biting your fingers and your nails, I highly recommend keeping a nail file with you in clinic because of your gloves and stuff. I just like love this and will never go back. But anyways, that is everything in my pencil pouch. Let me put it away and we'll keep going. Okay, in this pocket in my bag, I have another hair tie and another hair clip. You can never have too many. All right, that is it. That's all that's in that clinic bag. Let me get it packed back up and then I'll show you guys my last clinic bag. Okay, so last but not least is my ginormous clinic bag. Let's just dive in, shall we? In the outside pocket, I have this clear baggie that has my utility gloves. You wear these gloves whenever you clean your room. You wear these gloves whenever you spray Cavicide or use Cavi wipes. You wear these gloves when you hold any of your instruments. I have my clinic shoes, our school required black leather, so I got cloves, these are mine. I have tweezers. I have my Cavitron tips are nice and sterilized. Rinse for x-rays. What is this? This is the standard tip. Cavitron tip. If I'm using a Cavitron for both AM and PM, I can open this one first and then open that one just so that they're not all needing to be sterilized and then I miss out on having a tip ready. My sharpening kit right here, my Profi cassette number 2, my Profi cassette number 1, my sheath for polishing, my implant scaler. This is my Perio kit. I've never used it. My Gracie kit, my screening kit, my second rinse bag, and then I've got my blood pressure cuff and my stopwatch. I'm going to be buying a stethoscope for myself, like a cute one and a one-headed one. If you guys have any advice on which one I should get, please let me know. I hate this thing with a burning passion, but I also know that a lot of dental offices use automatic blood pressure cuffs, so I'm like toying with the idea of just dealing with it for a year and then not using it ever again. But then I'm also like, manual blood pressure is so much more accurate. That's just the truth. If I have my own stethoscope, I'd probably be willing to like do that for all of my patients. I don't know. It's a mental fight right now. I'm trying to figure out, but as of right now, this is my stethoscope for clinic. Yay. I've got my beautiful loops. These are my loops. If you guys want some more info on them, let me know and I'll give you a little like spiel, but I have Q Optics Ergo loops. I have a portable fan because it gets really hot in the room. So this is just like a portable fan that I can turn on. To help. It just died. I do have the charger. Anyways, it's a chargeable portable fan. It's nice and clinic. And then I've got my polishing cups in purple and lime green. And I have floss, my disclosing tabs, my clear lab glasses, my patient black glasses, the little polishing tool, and that's it. That's all that's in there. So this is what I take to school every day. These 2 clinic bags that I just showed you are what I take to clinic days. I don't take my backpack, but I do sometimes throw my iPad into that purse bag. And then on lecture days, I take my backpack only. I don't take clinic stuff. And just so you guys know, my clinic bag that I showed you, that's like a purse, that one gets put on my shoulders, which is why it doesn't carry too many things. It has like my binders, which are heavy, but not horrible. This clinic bag right here is so big and clunky, but it is a roller bag, and that is why it holds all of my crap, because I'm not about to put that on my shoulders. I actually used to have a different bag and switched very quickly to a roller bag because my back was just breaking. It was not okay. So make sure to watch your bag and your ergonomics and take good care of yourself, because you're gonna need to avoid any musculoskeletal disorders in this career, okay? But anyways, that was my what's in my bag video. I know it was kind of crazy and long, but let me know if you want any clarification on anything. Let me know if you liked that, if that helped you. Let me know if you want any links. I'll try to find stuff for you. But yeah, thanks for watching and thanks for being here, and I'll talk to you guys later. Bye.